I think we are all ready to go and start our Women's Wellness Retreat. Thank you all for coming today. I'm really excited. We have all beautiful products here and vendors, so please visit them. I just want to tell you a little story how I started doing these seminars. I have a company called Active Ayurveda and Yoga, and also Herbal Wellness. So I do most of the stuff for community, and my promotion is wellness and beyond. That's how we started. So then I started doing these small seminars, and it's going very well from last 3 years. And very well received. So please support wellness and beyond. And our today's retreat, going back to our today's retreat of Women's Wellness, we have keynote speaker Dr. Shobha Jagdish. She will be talking about women's wellness from puberty to menopause. And we have all these wonderful speakers lined up. So let's start with a prayer. Just please close your eyes. All the new announcements coming up, so in between we will announce. Monique is our MC today, and she will help you with your presentations as well. So I'll give this mic to Monique first. Thank you.
Good morning, everyone. My name is Monique, and as Jaya said, I'm going to be your host for today. And just to let you know a little bit of housekeeping, if you need to go to the restroom at any point, you go out the back doors and straight through, that's fine. If you need to exit, there is the exit door there in case of emergency, which I assume there will not be. There's also this one and that one. But before I introduce Shobha, what I'm going to tell you is my first experience here. So when I was asked to do the wellness event, I wasn't exactly sure what I wanted to do in terms of what exactly does wellness mean? Does it mean work-life balance? Does it mean making sure I eat my veggies instead of just sugar? What exactly does that mean? Why are we bringing you all here? And so I decided to take a yoga class here to learn a little bit more about the space. And Wendy was the yoga teacher that day, and it was raining. And she said something interesting that really connected with me. She said, it's okay that it was raining because the rain was going to nourish the earth and that the sun was just beyond the clouds. And the rain that was going to feed the earth was going to bring the flowers that we wanted for this spring. And so what I took from that was that we all have a connection to each other. And if I can ask you to do anything today, it may not be, everything here may not be for you, but there's going to be one part. Just find that connection that you have with something that you hear today, and make sure that you try to grow it so that you can be your better self. And that's what I'll ask for you today. So Shobha, who's going to speak next, is going to be Shobha Jagadish. She's an internist with Griffin Faculty Physicians with prior experience at the Cleveland Clinic, and her goal is to give her patients the best care that will suit each individual using a wholesome and integrative approach. She has a special affinity towards diabetes being a chronic illness, and it's particularly high with those who are in the descent, and managing diabetes closely linked to preventative care that includes prevention of heart disease and cancers. She gives the utmost fulfillment linking both preventative and multiple treatment modes that can be tailored to each individual person. So without further ado, I'd like to invite Shobha Jagadish to the stage.
Is this okay? Good morning. I'm so happy to be here today. Thank you so much for inviting me. So I'm an internist. My name is Shobha. I work with Griffin Faculty Physicians. And my passion is in general making everybody healthy, but today's focus is on women's health, so I tried to tailor the presentation towards that. And I shall proceed. My office is in Oxford. I've been in Connecticut for about 10 years. So, and I practice mostly internal medicine. So this is a slide just basically because, we can't forget that we were all babies at one time. And the focus would be on the last two right here. I think this is where the puberty starts, with that hair there. I think that's the start of it. And from here all the way towards here would be a focus on health today. So, sorry. So I just wanted to start off with a general diagram of hormones. So a lot of women's health issues are related to hormones. We all have basic anatomy in our body, and most of the times when patients come to my office, I like to kind of turn the computer, go into Google Images, and show them a picture of what's going on. So basically we have here, this is like the brain. The brain has the basic hormones that control all our other hormones all through our body. So regarding to women's health, from the hypothalamus, in the pituitary gland right here is where a lot of the hormones get secreted. And finally, our ovaries, this is an enlargement of our ovary, which, if you see here, this is an anatomy of our uterus, and ovaries sit there, and estrogen and progesterone secrete from there. And basically all of the hormonal issues, most of them in our body, related to women's health, come from these hormones. And these hormones don't just affect emotions, but they also affect any issue with the breast, bones, things like osteoporosis, our skin, leading to things like acne during adolescence, of course childbirth issues, and even related to the heart, which we'll talk a little bit about later when we come to menopause and postmenopause. So this is just another quick picture, and oh yes, I can't forget the thyroid gland, which I didn't show you there, even though that's not related directly, but indirectly the thyroid gland plays a big role in women's health. So these are just a list of common concerns that women have from puberty all the way to menopause. So PMS, premenstrual syndrome, starting from adolescence, going on till we hit menopause. A lot of younger people face issues with polycystic disease, where there's issues with infertility, weight gain, UTIs. I'm sure many of us have had urinary tract infections, have gone to the doctor, had issues with that. As we get older, there's incontinence, yeast infections, which are common in people who are healthy, but more so when you get things like disease, thyroid disorders, mostly underactive thyroid, breast pain, breast cancer, menopause, and I did not want to forget depression because depression is linked with everybody in society now. But of course, when we hit menopause, we become emotional, and that's a time where we become more sensitive toward things like that. So I think we've all gone through this. Whether it's PMS or being menopausal, we all get angry at some time. So this is just to relate to that. So I'm just going to start with puberty. So if there are not that many people who started puberty, I know many of us have children, or we know people. So it usually begins around the age of 8 to 13. That's when we start growing, gaining weight, and gaining weight in other areas, which is like the hips, the arms, enlargement of the breast area, increased pubic hair, and mood swings. I'm going through that, not personally, with a 14-year-old, but many of us have had experiences with that. And commonly during that, premenstrual syndrome is usually just around the period time where people get very emotional, can get emotional, irritable, as that picture that I showed earlier on. Difficulty sleeping, breast pain, bloating, dietary cravings. We crave anyway, but you start craving more sugar, more candy. And I wanted to talk quickly about how we can manage PMS. So first of all, I probably will be repeating this again and again, but nothing beats exercising and just having a wholesome, healthy diet. So that would be eating fruits, vegetables, whole grains, sleeping well, staying away from excess caffeine, and coming down to actually treating the symptoms, which if you're going to do all of those things anyway, just simple over-the-counter non-steroidals like ibuprofen, naproxen, or Advil, that's the trade name for it. Those kind of things can help, but in much more serious conditions, some people really need hormonal therapy, and that's when you would go to your gynecologist or internist to talk a little bit more about that. And as I know Jaya is very focused on stress management also, and she started off very well with the meditation and prayer we had. But just stress reduction in any way helps, all of those symptoms, whether it's menopause or PMS. I particularly love advising my patients to get into yoga and breathing techniques. A lot of people are very fearful about meditation, but that's a good segue into that. And last but not least, I'm not a proponent of medications, but there are low-dose antidepressants that can help PMS in addition to menopausal symptoms. So polycystic ovarian disease is common in younger women, and basically we all have a balance of male and female hormones in our body. Being female, you would have predominantly female hormones, and when those who have polycystic ovarian disease, which is quite common, have a predominance of the male hormones comparatively. And you get symptoms like weight gain, excess hair around your face, like your chin, your sideburns, even on your arms and legs. Under your arms, there's a fancy word called acanthosis nigricans, but you get darker pigmentation at the back of your neck. Pain in the pelvic area, but a very common nuance is actually infertility. So a lot of women who are trying to have children who can't struggle with infertility, and this is when basically your doctor would try and help diagnose that with lab testing and so on and so forth. But the long-term concern with polycystic ovarian disease is when, with the hormonal variation, the cysts in the ovaries, there's a risk of diabetes in the long run, cholesterol, and we know now there's a risk of endometrial cancer. So if anybody has signs of this, please see your doctor, and that can be taken care of. So very commonly seen in women are urinary tract infections. So this is a quick diagram of our anatomy. So these are kidneys, kind of right by your back. So when a lot of people come with back pain, I try to make sure it's not the kidney. So you have two on either side, and these are little tubes called ureters, very commonly where stones get stuck, here or here. And coming down here, right by the pelvic area, right around your uterus area is a bladder. And this, connecting from there is this little structure called the urethra, which is where we urinate from. So when we pee, urine comes from there, comes out of your urethra, and just comes out through a hole. So in women particularly, urinary tract infections are more common because this area, this structure right here called the urethra, is shorter. It's shorter in women, and because of the way a female's anatomy is, very easily the bacteria from the colon and the anus area, because there's not much of a separation, can easily enter this area, get infected, and into the bladder. That's why women have it more commonly than males. There are ways we can prevent it, but sometimes they're not preventable, and we'll talk about that. So before I went further, I wanted everybody to get an idea of the anatomy. So the risks for that is, so first of all, one is the structure, and secondly is the anatomy, as I spoke, menopause. So when we hit menopause, we don't have the hormones that are usually there prior to that, which is estrogen and progesterone. So when you don't have those hormones which protect you, that puts you at risk of urinary tract infections. So, and things like sexual activity, when you're pregnant, those hormones play a role as well. Certain birth controls, if anybody uses diaphragms, which are not commonly used anymore, which are like little cups, usually it's inserted and there is an agent that given that, a spermicidal agent. It goes into the cervix, and with that, that poses a risk of urinary tract infections as well. But I don't think people commonly use that now. I just wanted to mention that. If anybody's at risk of stones, kidney stones are a big culprit for urinary tract infections, particularly the kidneys, which are higher up, as I showed before. Anybody who uses catheters, or they have older family members who have catheters, those pose risks. Procedures, like if you've had sling procedures, or your urologist has put a scope in there, that can pose a risk for infections. And a low immunity. So things that we can basically do on a day-to-day basis, apart from coming to us for medications, to prevent: hydrate well, hydrate. Most people need about half their body weight of water a day to actually just stay healthy and hydrate. So try not to hold your urine. We've all done that. We want to go home and use the bathroom. Those are things that people get frequent UTIs. Frequently bathing. So some of the bacteria we have in our body we need actually for protection. So too much of bathing and soaping can actually cause that. And a common issue that some people don't do, but when you should be doing, is every time after urination, wiping from front to back and not the alternative way. After sexual activity, emptying your bladder, it's common for some women to get UTIs right after sexual activity. And with that, actually, it's sometimes just not preventable. Right after intercourse, there is an antibiotic that you can take, and that can quickly eliminate that. So you won't have to frequently use an antibiotic. Avoid irritating products like douching and changing a birth control method if that's the cause of it. So incontinence and overactive bladder is a very common issue starting the perimenopausal age group. So when I say perimenopause is around the time when you're about to hit menopause. So per definition, menopause is when you've not had your period for a whole year. So right around that period, you might be getting excess bleeding or like mood swings or irregular periods, which we did not have before. So there are different types of incontinence. And as the population is aging, it's actually becoming more and more common because it's inevitable with the hormonal changes in our body. So what the definition of incontinence is actually just leaky urine. Now, leaky urine when you don't have the sensation to go. So one of the common things, even in people who've not hit menopause, is stress incontinence. So we've all had those times when you can't stop laughing and then you go home and you're like, oops. So that's one thing. Or if you're coughing too much, you've had a respiratory tract infection and you're leaking, those are common causes. Those can be easily prevented by Kegels exercises, where you just control your bladder for 10 seconds, let go, and if you do this as an exercise, like if you go to the gym, that can help it. Another cause of incontinence is when your bladder is just overactive. Overactive is just being stimulated for no reason. You have no control over it, and it's just so you constantly have this need or want to go to the bathroom, but you may not really have to go. And when you go, you may just have small amounts or just not go at all. And the worst part about this, you might not get there in time because you're constantly irritated. So that's a problem. Another type of incontinence is some sort of obstruction, whether it's your uterus falling down because of prolapse. So as when people have had many pregnancies, their uterus can just fall and press on your bladder, and that can be a cause where you just can't empty your bladder. Finally, kind of like it's just like dribbling down. And a lot of these, they're interconnected in causes, but weak bladder muscles, weak pelvic floor muscles, which are underneath and around the bladder. You may have a tumor or a fibroid that's more common, that can press on it. Constipation, which is common as we get older, and lack of fiber and lack of exercise, all these things cause constipation. That can press on your bladder, and certain medications. So first of all, like anything, you treat the root cause. So if it's stress incontinence, Kegels exercises, as I mentioned. Some places, like our hospital at Griffin, we have a physical therapist who helps patients just do physical therapy, helping them strengthen their pelvis. So it's, if it's really bothering you and you really don't want to be on a medication, which is what I would advocate not to be, that would be one way to go. Doing the pelvic floor exercises. And there are certain medications. So if anything beyond that, I would definitely see a physician, because it's something a lot of people don't like to talk about, but incontinence is so common, so common. And I haven't mentioned this anywhere in the slides, but I just want to add that even bowel incontinence is common. That's something nobody wants to talk about. It is embarrassing, but we're there to help. So as you've had children through the years and you've had normal deliveries, all your muscles, not just your bladder and the pelvic floor, but even the muscles around the rectum area and anus, they all get laxed. So there's a possibility that you just start leaking and you don't want to tell anybody. So that's something you should talk to your doctor about if you know anybody, because then we can look into why. Because one is we presume that a lot of times we presume that it's age-related, but sometimes it's not age-related. Sometimes you're leaking because there's a tumor there. Sometimes your bowels are leaking because you may have colon cancer and you've not really had a colonoscopy or been evaluated. So that's something I definitely would advocate. And I think we know this, but I just want to reinforce that excess caffeine, we all know, makes you go to the bathroom. And acidic foods, a lot of citrus, tomatoes, things like that can be irritating too. So yeast infection, this again is very common in women. And more so if you're diabetic or have any sort of immune system compromise. So if you've had recent chemotherapy, if you're just very stressed, because stress can actually reduce your immune system. Lots of things, and pregnancy. But basically, a yeast is a fungus, which is different from a urinary tract infection, which I spoke about before. A urinary tract infection actually is caused by bacteria. Usually the bladder and urinary tract is supposed to be sterile with no bacteria. So when that comes, you get a UTI. When it comes to yeast infections, yeast is a fungus, and actually it lingers around there, but when it gets excessive, it causes irritation and discharge. So, and both of those diseases, urinary tract infections with bacteria, it is not always so easy to differentiate. But with this, you have more of discharge, irritation, itchiness. But not to take this for granted, STDs, sexually transmitted disease, can also be mixed up with this, because if you're irritated and having discharge, if you're a high-risk person, we definitely would like to test for that, and you can give a urine sample, and there's lots of things that we can do at the office to test for that. Estrogen and taking pills also, which I didn't want to forget to say, can also put you at risk for yeast infections. So some housekeeping for preventing yeast infections. wear underwear that has cotton crotch and doesn't fit too tightly. So I know nowadays there's all these advertisements. It keeps popping up on YouTube for me and I can't stand it. About these underwears that like hold your belly in and they're so tight. So things like that, I mean, those are the kind of things where you're getting UTIs that actually, that can promote, yeast infections. But tight-fitting pantyhose, douching, a lot of bubble baths, tampons. So I'm not saying all of this causes this in everybody, but if you get yeast infections, these are things to look into. Excess of antibiotics. So I think over the past few years, my experience with patients, I think people are realizing that antibiotics are not the right thing for colds and coughs. But for those who use it excessively, that can definitely promote yeast infection because we have a lot of good bacteria in our body. So when we take antibiotics, especially when you don't need them, the antibiotics actually kill that good bacteria, those good bacteria. So as a result, this yeast loves that environment and just grows and grows and then causes all of those symptoms. And for swimmers, if you stay in your wetsuit a lot or at the beach, and for people who love going to the gym or runners, if you sweat a lot, that can promote it too. So I'm focusing on hypothyroidism because that's more common than hyperthyroidism, but thyroid disease, the thyroid is a gland that lies right at your neck, right in the front here, and it is the motor house for a lot of issues in our body. So the thyroid gland cannot produce hormones from two reasons. Either your brain hormone is not allowing this because it's connected to produce more, or it in itself is not producing more. So when you go for your physicals, in general, your doctor would be checking your thyroid hormone. There are rare instances, not rare, I would say, but infrequent instances where your thyroid may be normal, but you're at risk because you have a very strong family history or you have antibodies. So on occasion, your doctor would probably look into further testing, but basically your thyroid hormone, when you're underactive, you have the symptoms of fatigue, being cold, gaining weight, which no woman likes, just dry skin, feeling blood, depression, irregular periods. That's a very common symptom with thyroid disease, especially in younger women. And thinning hair. Thinning hair is as it is common as you get older because of hormonal issues, but with thyroid disease particularly. And your memory. You can become foggy, almost like when you're depressed, I would say. So a lot of those symptoms can be related to thyroid disease. So per guidelines, a thyroid hormone is supposed to be checked every 5 years. But to be honest, because of people have so many symptoms that interlink, we tend to check it every year. So breast cancer is the number one cancer in women. 12%, that's 1 in 8 of us are at high risk of breast cancer. And 1 in 8 of us have a chance at some time in our lifetime of developing breast cancer. So screening, depending on what medical organization you belong to, they have different schools of thought. Some say 45, some say 40. Personally, from all of my female physician colleagues and breast physicians I've worked with, if it were me, I just would want one every year regardless. Women always say that, I had a mammogram, but everything was fine, but you need a breast exam as well. Mammograms do miss 10 to 15% of breast cancer. The breast pain is common, but what I want to reiterate is that you have pain in one side of your breast and it's getting worse and not getting better. Even if you've had a mammogram, please see your doctor because that will be a concern. So I think this is very familiar for a lot of us. Feeling hot, want the window open, no matter what, your spouse's like, can you please? So my hot flash is not going away. So as I said, officially, it's 12 months of no period, no menses is menopause. Hysterectomies, especially if you had your ovaries out, those particularly can cause a menopause. So if you're younger and if you had your ovaries out for any reason, you could have hit menopause earlier. So that's something to be remembered. Chemotherapy, and 1% of women below the age of 40, in their 30s or early 40s, have this primary ovarian insufficiency, where basically you just fail to produce hormones and you hit menopause much earlier. So I alluded to a lot of this before with the thyroid because there's so there's such an overlapping of symptoms, but fatigue, irritability, dry vagina, weight gain, hot flashes, can't tolerate cold or hot. Those are a lot of the common symptoms of menopause. I think I may be running out of time in about 5 minutes. How much time do I have, Jan? How much time? I do? Oh. So,
last 5 minutes maybe for the question.
Okay. So, most of us know what menopause is, so I just want to go into the complications of menopause because those are really important. So, risk of heart disease as it is the number one killer in our country. So, whether it's males, females, the risks are high for multiple reasons. But with menopause, the risk goes up because estrogen, which we produce, declines in menopause, and estrogen is protective. So when estrogen is protective, now we don't have that protection that puts you at higher risk. So risk of heart disease goes up even more. Incontinence, as I spoke about before, everything loses its elasticity, puts you at risk of that. Vaginal dryness, as I mentioned, and weight gain. So I always advocate the most natural types of therapy for menopausal symptoms. But as I alluded to before, exercising, vigorous physical activity can really help some of those symptoms. May not stop it completely, but can make it tolerable. Some women say exercising in the morning is better, exercising in the evening is better. Just have to figure out what works for you. Hormonal therapy, that's if nothing you do makes it better, that there's nothing wrong with hormonal therapy for at least a brief period of time. I do want to mention that there is a long-term risk of breast cancer and endometrial cancer with hormonal therapy if anybody's on it. But I'm not against it also, only because for some women it really makes a difference in their lifestyle. If you have such terrible menopausal symptoms, you have to weigh the risk and the benefits. So if you're really low risk, you don't have a family history of breast cancer, you don't have family history of clots or any form, and you're very healthy, the hormonal therapy right here may be a good option for you. For women with a lot of vaginal symptoms, the dryness and irritation, your doctor can prescribe you with estrogen cream. It's just a topical cream that you apply, and it really does alleviate a lot of symptoms, can prevent yeast and urinary tract infections in women. A low-dose antidepressant. So if we prescribe low-dose antidepressants, it's not because we think you're depressed. It's just that because those medications, if anybody's heard of Lexapro or Zoloft or sertraline or escitalopram, these are some of the names of the medications. A tiny, tiny dose can just alleviate some of those symptoms. So for example, if you don't have vaginal symptoms, there's no point using the vaginal estrogen. You'd want to maybe look into the medications if everything you're doing natural therapy-wise has not been helping. And I just wanted to mention a few medications like gabapentin and clonidine. Clonidine is used for blood pressure, not commonly. Gabapentin is used for everything under the sun. Back pain, seizures, I can go on and on. So that's a low dose of that could help as well. So I wanted to talk a little bit of the other illnesses related to not just women and men, because it's very common. Once we hit menopause, particularly and as we advance in age, memory declines. Not always, but it can decline. And it's not just the memory with dementia. So we have a misconception sometimes if it's not just memory, I can't have dementia, but basically you have to have an issue with your daily functioning capacity. So retaining any sort of new information. Most people who have dementia, they remember things from years ago, from childhood. They just can't remember recent events. Handling, so if you could write a check and now you have trouble writing a check, there's a problem. If you could go to the bank and you can't anymore, that's a problem. If you used to pick up your grandchildren and now you just don't know your way, that's a problem. Things like that. Just getting lost and word finding. We all forget sometimes. My kids are constantly making fun of me because I'm like, what's her name? What's her name? I'm like, I'm pretty sure I don't have dementia. Too many things in my head. But it's more of like you really can't find basic words that you would know. So this is a picture of a healthy brain, and this is a picture of somebody who has dementia. So basically, as particularly Alzheimer's, which is only one type of dementia, actually, but there's so many other types of dementias, that this is how our brain will look. So depression. The depression really saddens me because sometimes we feel helpless. Patients come with depression because of medical problems, but I think with stress in society, maybe a lot of other things, a lot of people suffer from depression. And depression is sadness and lack of interest, but the one thing I'd like to say is that a lot of people who have depression may have conditions like bipolar or anxiety or post-PTSD. So your doctor should be asking the right questions to make sure that it really is not some of those other things. I've referred some patients, and I've learned, because we all learn as we work and grow, that patients we were treating as depression really had bipolar and being treated incorrectly. But you know, especially as we get older, as community dwellers, when you get older, 2 to 10% of the population have clinical depression. Again, you don't need medications, just lifestyle, exercising. But a few common things apart from the meditation, yoga, exercising that really help. In my practice, I've seen commonly people who socialize, have a great social life. That doesn't mean partying. All it means is just hanging out with people who you love, are like-minded, and find a way to socialize. All the male patients who come, they go for coffee every morning, or the female patients who they play mahjong. Believe it or not, they're all really, really are healthy mentally, and I can just tell they're so sharp. So socializing in whatever form, whether it's going to church, I just notice people who pray and go to church, they just have such good mental outlook, limiting depression. So osteoporosis and osteoarthritis, very common confusion. So when I tell patients they have osteoporosis, they're like, but I don't have any pain. But I'm like, you're not supposed to have pain unless you've had a fracture. So the difference between I just want to go to my slide first. Okay. So basically the difference between osteoporosis and osteoarthritis. So both are common as you get older. Osteoporosis is when you've hit menopause, but can occur before, when your bones actually look like this. They're very holy. So this would be here a normal bone where everything is packed in nicely. And if you have osteoporosis, your bones are really holy. And this is really easy to detect with a simple bone density your doctor should be doing once you hit menopause or just around that time. So medical guidelines tell us to do it at 65 and above. I completely disagree. I've had multiple people, because of risk factors they have, their mom having osteoporosis, or they have thyroid disease, or they drink excess alcohol, or they smoke. Those are risks, so we should be it's a really simple, painless 10-minute test. So that's osteoporosis. Osteoarthritis is when your actual joint here, which is the space between two bones, right in the middle of your knee or in the middle of your elbow, this starts getting inflamed and it starts narrowing. This is basically close to normal, starts getting narrower and narrower as it progresses, and when it's pressing, that's when you're probably in pain. So this is when you come for help, for either medications, physical therapy. Your orthopedics, typically we can give you shots there. So that's the difference. But to prevent, really, as the goal is prevention, is weight loss and physical activity are just two key things which really prevent osteoarthritis. Now, you can imagine, even a 5-pound loss can actually alleviate that. If anybody has lifted weights or done weights, important for osteoporosis prevention, it's not insignificant to do weights with 5 pounds. So can you imagine 5 pounds excess on your body and losing those 5 pounds? How much beneficial that would be for your knees. So I have a little short of 5 minutes. So I just wanted to talk about osteoporosis prevention because this is very important, not just for osteoporosis prevention, but also for prevention of health in general. So all of us, if we've not hit menopause, need 1,000 milligrams of calcium a day. So a cup of yogurt, a cup of milk, approximately has close to 300 milligrams. So multiply that times 3 servings or an ounce of cheese. will give you close to enough if you're going to take a multivitamin also. But once you've hit menopause, your hormones are no longer protecting, your bones are a little bit weaker, even if you've had a normal bone density. In that case, you need 1200, and if anybody has actual osteoporosis, you need about 1500. But I cannot stress more physical activity and exercise. So walking is really good because it's weight bearing on your hips, but it's really important to do weights. So you don't have to be a gym buff. You don't have to go to the gym in a tank top. You just need to have 3-pounder, 5-pounder weights at home and just do them as much as you can. Even walking upstairs is weights because it's like weights on your thighs and the muscle, and there's an indirect way weights actually help strengthen your bones. And heart disease, I won't go into that much because of lack of time, but as I said before, menopause and heart disease go hand in hand. Heart disease is the #1 killer in society, and our BMI for most of us should be 25, which is your weight divided by your height, is a calculation. Most average people are not weightlifters, so most of us should be 25, and most of us are not. So any excess weight is a risk for heart disease, in addition to other things. And I just wanted to show you a quick size of this is what happens in our arteries, whether you have heart disease or not. Many of us sitting here, this is probably going on in our arteries, and we don't know, we don't feel it. Because with obesity, there's inflammation going on in our body, which you can't see by blood tests. So patients love saying that, my blood tests are okay, so I'm fine. But your blood test is not going to show you the inflammation that's actually going on inside your arteries. And you don't want to wait till you have a heart attack. So over time, that inflammation starts, they love this, they start sticking there, and the fat starts sticking to this inflammation, a lot of inflammatory cells, platelets, and it produces this little mountain-like thing here, and you feel absolutely fine. It's only one day you get this pressure or pain or blood spot, or the worst thing, there's sudden death is the worst thing. So that was the end. So there's diabetes, there's colon cancer. I just don't want to not forget about this because everybody's shy of getting colon cancer. Not everybody, a lot of us, but it's the 3rd highest cancer, very common. Can be easily tested with a colonoscopy, which your doctor should be advising. It's not painful, understandingly a pain in the butt, no pun intended. And thank you.
Thank you very much. Thank you, Dr. Shobha. It is so depth knowledge today we got showered with, and we always do Google search, but we don't find all of these details. Thank you so much, and thank you for accepting my invitation to talk to you today. And this is my little gift certificate for you.
Thank you so much.
Thank you.
Thank you.
Okay, so our next speaker is Indira, and she's going to talk about nutrition and wellness. So, Monique will introduce her.
Sure. Thank you, Shobha, for that. You packed a lot of in such a short period of time, and I think what I got out of that is that many of us experience similar things and we don't want to talk about it. So realize that all of us here have similar experiences, and what you're feeling in your own body might be something else that someone else has. So don't be afraid to go speak to your doctor and learn a little bit more about it. The next person that's going to speak is Indira and she's a nutritionist therapist, a cooking instructor, and a passionate foodie and food blogger who blogs at Cook to Nourish. She's who specializes in treating digestive disorders and autoimmune conditions. She has a master's from the University of Florida and an MBA from the University of Connecticut. Before working as a nutritionist, she worked as a researcher in the healthcare industry for 15 years. She started looking into healing diets 3 years ago to control her severe and painful rheumatoid arthritis when medications alone were not enough. Diet and lifestyle changes helped her tremendously to reduce pain and inflammation, which motivated her to become a nutritional therapist. Cook, Eat, and Nourish is her motto, and her website, Cook to Nourish, has delicious and healthy recipes. So here we go. We have Indira for that.
Hello guys. Good morning. Okay. Hi, thank you for having me here. Thank you, Jaya, for inviting me for this. And when Jaya initially talked about this seminar, she talked about really bringing together a lot of wellness experts and talking about all the different things that women can learn about that will help them cope with all the specific diseases that we have to face. And we particularly talked about hormones and how they affect our body. And Jaya suggested that maybe I can talk about diet and how that influences hormones. And she, in her usual sweet voice, she went about telling me, maybe you can talk about diet and how it impacts women from puberty to menopause until after menopause too. And I'm like, whoa, that's a vast and complex topic. And I'll probably need to stand here and talk for the rest of the day if I have to cover everything. But thankfully, Dr. Jaya covered a lot of the issues that women face. And plus, as I try to put this presentation together for you, I try to focus on some small takeaways that I can give you guys that you can bring back to your life and implement it. Small changes that you can make in your lifestyle that will help you cope with the problems that women have to face. All right? So I'm going to try and make it very informal. So if you have a question of something that I'm talking about, you can just raise your hand. As long as we don't get too many interruptions, I think that should be all right. Okay? So, it's too hard to manage two things at once. Where should I point? Yeah, probably. Okay, thank you. So a quick overview of what I'm going to cover. I'm going to just give you an overview of what hormones are, what they do in your body, why do they fluctuate, what are some symptoms of hormonal imbalance, and then I really want to focus on what are the foods that you need to avoid, what are the foods that you need to embrace, because it's really a thing about both of these things coming together that's going to help you. It's not just about avoiding certain things, but it is also about including certain things in your diet, and that's equally important. So I'm going to talk about that. And then lastly, I'm just going to give you some lifestyle tips that you can incorporate in your life that will help you in terms of hormones. All right. I'll give you a minute to read this. And raise your hands if you agree with this. So, I know, right? And sometimes I feel like I don't even know how many sides. It's more than 3, right? And I have. I'm a poor husband who has to deal with that. But on a serious note, I mean, it does not have to be that bad. A couple bad days in a month, that's all right. But if you're constantly having mood issues, that's a problem. And what tips that I'm going to share with you today is going to help you that. So you do not have to have this problem always because that's not normal. Okay, so I don't know how readable this slide is, but, and it's okay if it's not that clear. Because the real message that I want to show you here is that when you talk about hormones, there are a lot of different things going on here. Right? There are a lot of different organs in our body that are involved when it comes to hormones. And Dr. Shobha also actually touched upon a lot of this when she said that it's a complex system. So the key things that I don't know if you can read the ones on the green, and I'll read them out to you. the pituitary, the thyroid, the adrenals, and the sex organs. Those are the key players. And the rest that you cannot see, the blurry ones, they are basically just saying those are the other organs in your body. But those lines, right, you have dotted lines and the solid lines, and they are all saying that there are all these complex interrelationships that are going on between the different organs. And the key players are the pituitary, thyroid, adrenals, and the sex organs. And when you say hormone, what is a hormone? The body manufactures greater than 100 different hormones. And what they do is they are like a messenger. So they are attached to a particular, or attached meaning not physically, but they are related to a particular organ. And it's basically they convey message between the brain and the organ. So the brain tells the organ, brain wants to tell the thyroid, increase the thyroid hormone for metabolism. Then that's how, that's what the thyroid hormone does. It goes and relays that message to the thyroid gland. And it works backwards too, the same thing. If the level's lower, then again, there's a positive feedback mechanism and a negative. Basically, what I want you to get from here is that everything is interconnected. This entire system works as a whole, right? It is a whole is what it works like. And it is not just the individual components that you need to focus on. And this one, I think, says it very nicely, that what the hormones do in our body is nothing short of a symphony, an orchestra, where everything is working really in sync, right? All the hormones, all the glands, the signals from the brain to the glands, they are all working correctly. That's when you have a perfect orchestra that is in tune, right? The moment something goes wacky, out of whack, then that symphony is lost. And that's when you have problem, because the harmony is lost, the balance of the body is lost, and that's when you come across different issues and complications. So it's not working, right? Okay. Oh, I hope you heard me. I'm pretty loud, right? And now I'm even louder. You guys were like so attentively listening to me, so I didn't even realize that the mic was not on. Okay.
Sign up to audience.
I know. Thank you. So why do hormones fluctuate in the first place? They can fluctuate. So what I just showed you in the two slides, that's the ideal state, right? That's how it should be. But then we have fluctuations, right? People experience a lot of problems. And what is the problem? What are the reasons for those? The number 3 bullets, the first 3 bullets, gut health, metabolic health, digestive health, they all pertain to the same issue, which is food and diet. Okay? And I'll explain to you what each one means. Gut health means that because of your poor diet, because you're not eating well, there is inflammation in the gut, there is leaky gut. And leaky gut is a cause of a lot of immune problems, and immune problems indirectly also cause hormonal problems. Okay, so that's the first one. The second one is metabolic health. Now, metabolic health related to poor diet is what happens when you eat a lot of processed foods, you eat a lot of sugars, you eat a lot of carbohydrates that are refined carbohydrates. Your blood sugar just spikes up. You go on the sugar roller coaster where your glucose is spiking up, and when your glucose is spiking up, insulin, that's a hormone that's secreted from your pancreas, that shoots up too, because the role of insulin is to balance your blood glucose. So your blood glucose needs to be at this level, for example, that's your baseline. But when it goes too high because of the sugars that you're consuming, then insulin acts and it puts it down. Insulin is just trying to help, it's trying to control the blood glucose. But because the spike was actually very sharp in the first place, the insulin acts also very sharply and you get a dip. So now this dip is bad because if this is your baseline, your dip makes it go even below the baseline, right? So just picture yourself, it is actually peaks and valleys, and then there is, I should have had a diagram for that, but then there is, a straight line, which is your normal one, but essentially you end up in peaks and valleys. And why this is bad and how does it relate to hormones? Because cortisol is the one that has to bring the glucose back up. Whenever blood glucose drops too low, adrenal glands, which was one of the 4 glands, if you remember that picture, right? Thyroid, adrenal, pituitary. So adrenal glands are the ones that give out cortisol. And that's the hormone that tries to bring the blood glucose back up. So when too much of cortisol is generated by the adrenal gland, then that brings all your hormones out of whack. So again, go back to the diagram with all the different relationships going on. If there are too many hormones there, and if there is too much quantity of one particular hormone, that means that something is not in sync. I don't know what keeps going on. Okay, so that means it's not in sync, and that's the reason your metabolic health, or as related to the diet, is important, because it just ends up, getting all your hormones out of whack. The third thing, actually, don't mind this, is digestive health, as it relates to not being able to digest your things properly. So digestion is at the core of a lot of ailments, and I think Dr. Jaya will agree also, that's what, Ayurveda will also agree with that, where digestion is at the core. So if your digestion is not proper, you end up getting deficiencies. Like you get mineral deficiencies, vitamin deficiencies, and what that ends up doing is you are not able to manufacture the hormones that your body needs, right? Because what are hormones? They are actually chemicals, very complex, but they are synthesized within our body using the foods that you eat. And there are a lot of complicated reactions because hormones are like big molecules, and to make that, you need a lot of things for that to happen. In addition to your food that you eat, you need to have the minerals and vitamins for those hormones to be manufactured. And if that is impaired because of digestion, then obviously you will have hormonal issues. And if your liver is not able to detox properly, then also you will have a problem. Why? Because one of the things that liver needs to do is also excrete excess hormones. So again, go back to that slide where you want perfect hormonal, that orchestra slide, right? If everything is working perfectly, that means your hormones are all in the right ratios. And they, after the job of a particular hormone is done, they need to be eliminated out. They need to be excreted out from the body. And the liver does that. And if your liver is not working properly, if it is clogged up because of all the bad foods that you're eating, I don't know why.
Check.
So when the liver gets clogged, then it's not able to eliminate or excrete out the hormones, so that the levels of some hormones rise. And some hormones rising again is a problem, right? Because it's messing up the levels and it's messing up the orchestra, basically. Just go back to that. And then quickly, just I'll address stress. I cannot stress enough about stress. And Dr. Shobha also mentioned about this, because stress, again, like that sugar roller coaster that I talked to you about, and where I said cortisol from the adrenal glands are involved. So when you have stress in any form, whether it's a physical stress, an emotional stress, or stress that you're giving the body by eating the bad foods, it's actually triggers the adrenal glands to generate more and more cortisol. Because our adrenal glands are the ones that are protecting your body from, it's like the flight or fight response. Basically, when humans were out in the caves and cavemen, right? When a predator approached them, we were made that we could run or fight. Either run or fight, and that's the adrenal gland's role. So when stress, that's what stress does to the body, because whatever stress you give the body, whether it's emotional or physical, the body perceives it as that kind of stress that it has to save itself. And so the adrenal glands kicks in, and then the cortisol, and then the same stories, right? It's messing up all the hormones. And that's the reason stress is really bad for you. And then along with stress, environmental toxins, and toxins, well, the way they do is because they damage your liver. And when they damage your liver, your hormonal metabolism and excretion gets affected too. And then other things like lifestyle, alcohol, smoking, drugs, and sleep. Sleep is again very, very essential. Again, the same thing. It's related to the adrenal gland. Because unless you sleep for at least 7 to 8 hours every day, your adrenal glands are not getting enough rest. They need rest. I don't know. I hope I'm sounding okay and going out because this keeps shutting off on me. So that's why sleep also is very important for your hormonal balance. Again, just going back to the adrenal glands. So, and what are some symptoms of hormonal imbalance, right? When you say hormonal imbalance, what are the things? Acne is the first thing, right? At puberty, a lot of the girls will start getting acne, pimples, and at that age, that seems like the worst thing to ever happen to them, right? But now we know that it's not too bad. And then irregular periods, which of course is bad, and that can be really harsh on kids. I remember suffering from that when I was in my teens, and it's not a good thing. And then of late, the cases of infertility and PCOS, they are all rising. And one of the reasons is because, as you remember from the previous slide, when I said the lifestyle, environmental toxins, and stress, lack of sleep, along with the diet, right? All those things are contributing to an increase in all these conditions. And so these are just some symptoms that you may have that could be actually related to a hormonal issue. So instead of trying to go to and just treat that particular condition, you would be better off taking a holistic approach. Look at your diet, look at your lifestyle. First try to rectify that. And in many cases, the things will, the symptoms or all these symptoms that you're having will start disappearing on its own when you take care of all the big pieces. Okay, this is another important slide that I wanted to share with you, where each and every hormone and along with the gland that's associated with them, they have specific nutrients that they need for them to function well. So once you know what those nutrients are, what you can do is you can specifically use foods that can support that particular organ. So, and the foods that I have, I've just listed the big ones, but once you Google for what are the foods that have those particular nutrients, you might end up finding a bigger list, and then you can try to adhere to those foods. But the big ones that I want to highlight here are, when we talk thyroid gland, right? Selenium is an important mineral that the thyroid gland needs, and along with iodine and vitamin D. And some of the foods that you can eat to really nurture your thyroid gland are Brazil nuts, kelp, and cod liver oil. Again, those are some individual things, but actually for selenium, you could also, a lot of the seafoods have selenium in them too. So for thyroid, actually, if you eat seafood, really focusing on shellfish will help you increase your intake of selenium. And then for adrenal gland, It's vitamin C, all the B vitamins, they are extreme. Vitamin C is extremely important for your adrenal gland. And for most of my clients, I recommend them that everybody has a good dose of vitamin C every day, because vitamin C is so critical for the adrenal gland. And as I was just explaining to you, with the entire hormonal cascade, adrenal gland plays such an important role that really taking care of the adrenal gland is important, and all the B vitamins. And then for your pancreas, right, chromium is another mineral that's extremely important. And there have been studies that have actually shown that people with diabetes, when they eat chromium-rich foods or they supplement with chromium supplement, they are able to manage their blood glucose better. So chromium is that important, and it can be found in such supplements, such foods as onion and potato, which are very easily available. And brewer's yeast is also one that is filled with vitamin B complex and a lot of minerals. So that's a very good supplement, or you could even just add it as within part of a diet, or you can add it as a supplement. All right, so okay, now to the next part, which is the foods to avoid. Now, what are the foods that you really need to avoid? Now, I've highlighted the first three together because they are really all lumped together. They are very closely related. When I say processed foods, sugars and processed oils, they are all somehow, there are a lot of overlap within those categories in the first place, and then they are very related. When I say processed foods, can somebody give me an example of processed food?
Things that are packed, anything out of the box. Granola bars.
That's very good. Anything out of a box. Yeah, granola bars also. It's basically, what was that, crackers? Yes. Yeah, crackers too, unless they're homemade, right? Anything from a package is processed. And some are even worse than others, right? Depending upon the kind of things they have in them. So you have number one is breakfast cereal. So the number one thing that I ask people to stop is your cereal in the morning. Starting your day with a packaged food is not the smartest thing to do. Although it's very convenient, it's not the smartest thing to do. And making that change, that one change, will improve your life considerably. Because, and once you think of options, there are a lot of options. Eat eggs for breakfast, or eat oats for breakfast. Eat something that is that you cook, right? Or just have a smoothie. Have a smoothie with fruits and vegetables and good fat like avocados or nuts. Make that change. But avoid, or just eat vegetables, roasted vegetables or something, but just don't eat that cereal. And then baked goods like cookies, and unfortunately in our culture, it's like even the school culture, I cringe every time I get a note from my daughter's school saying that they have a function and the teacher is requesting cookies. And I'm like, no, I don't want to send cookies in there. and sometimes it's really ridiculous because they are also saying that don't bring homemade cookies. They want the packaged cookies because they can see all the list of ingredients in there. And I'm like, I cannot do this. I cannot send a packaged food, cookie. But unfortunately, that's the current environment. But slowly you can make that change. Start making that change yourself. And as more and more people join in, I hope that we can change our environment. And soda is another one that is really bad. Actually, if you go on so here are the sugars, right? And the processed foods are really bad because of the preservatives, the artificial colors, and the sugars. All processed foods, that's the thing, they have a lot of sugar in them. And I don't know, is it readable? This is not very readable, is it? Okay, I'll read it out for you. So these are the hidden names for sugar. Okay, high fructose corn syrup, disaccharides, saccharides, molasses, sucanat, polysaccharides, sucrose, fructose, invert sugar, dextrose, sucrose, glucose, lactose, sorbitol, mannitol, honey, malt extract, maltose, rice extract, golden syrup. These are all the different names for sugar. So if you see any of these ingredients and you say, oh, there's no sugar, you're wrong. Those are sugar, they're just different. The manufacturers just get very clever around how they can, make more people buy their products. And the other thing also I want to highlight, although I think we are very close to end time, but I want to really focus and want you to really get this so that when you go outside and shop, I want you to be a smart consumer. How do you know how much sugar is any package or any food? Because the ingredients the label will list it as grams, right? It will say as 5 grams of sugar or 10 grams of sugar. And you are like, what does 5 grams means? Maybe it's not too much, right? You don't realize how much it means. But 5 grams of sugar is actually 1 teaspoon. So when you say 1 can of Coke, it actually has close to 40 grams of sugar, which means it has 8 teaspoons of sugar. So when you have a can of Coke, you're actually consuming 8 teaspoons of sugar. Can you imagine eating 8 teaspoons of white sugar? So that's how bad it is. And then the other ones, even this yogurt, the fruited yogurts which people buy, there are people who come to me for weight loss and then they say that, oh, I've been eating really a very good diet. I eat only this yogurt during lunchtime. First of all, that's not enough. You have to eat a healthy, wholesome diet. And second of all, that yogurt is loaded with sugar. So you are not doing the right thing, for sure. So I really want you to, going forward, just take a look at the label and see how much grams it has and what you're consuming. And the other thing with sugar, we already talked about the sugar roller coaster, so I'm not going to mention that. But then, other thing that sugar does with respect to hormones specifically also spikes up the insulin, right? It spikes up the cortisol, I told you, it spikes up the insulin. And that insulin is actually a direct testosterone stimulator. And as Dr. Shobha said, we have both kinds of hormones. We have the male hormones and the female hormones in our bodies, but the balance is important. Now, when you consume a lot of sugar, the testosterone in women goes up. So that, as you can imagine, is not the right thing, right? We are women. We don't want the male hormones to be more than our female hormones. And that's what happens, and that is what actually results in irregular periods, acne, and infertility. And then again, continuing with foods to avoid, another food that you really recommend people avoid is because they contribute to a lot of inflammation inside the body, and these are all artificially processed oils. So refined, right? Anything refined, stay away from. So all these refined oils, although they say that they are really healthy for you, they are not, because they are full of chemicals. Because the very fact that how they refine the oils actually puts a lot of chemicals in them, and all you're ending up doing is consuming a lot of chemicals and omega-6 fatty acids, which are really trans fats, and they are bad for you. Now, in general, omega-6 fats are not completely bad for you because your nuts also have omega-6 fats. And your body needs a balance of omega-3 and omega-6, but it needs much more omega-3 than omega-6. And that's why you should avoid these oils because they only have omega-6. And if you're only consuming all these oils, you are actually damaging your body, causing significant inflammation. So, as I said, other than avoiding, what is really important is also what to embrace, right? What are the things that you really need to eat more? Good fats, and that's the number one thing, and people are surprised, right? When they come to lose weight also, I tell them eat good fat. You will not gain weight, you will only lose weight when you eat good fat. Because remember the sugar roller coaster again. It's the carbs that cause your blood glucose to go up and down. And that's what messes up your metabolism and slows your metabolism down, and that's where actually your fat deposits, or that's where you conserve fat.
But when you eat good fats, your metabolism will actually work normally, and you will